About 2% of the UK population have hypothyroidism, and women are 5 to 10 times more likely to be affected than men. Because of this, managing hypothyroidism during pregnancy is well understood, and the vast majority of women with well-controlled hypothyroidism have uncomplicated pregnancies and births. In this short video, we'll explain how hypothyroidism can affect your pregnancy, how pregnancy can affect your hypothyroidism, and what you can expect before, during, and after your pregnancy. How could hypothyroidism affect my pregnancy? Uncontrolled or undiagnosed thyroid disease can make it harder to conceive. Thyroid hormones are crucial for your baby's brain development, and you will need to take additional thyroxine because your baby doesn't make enough of the hormone themselves until you are 18 to 20 weeks pregnant. Other risks of uncontrolled severe hypothyroidism include increased risk of preeclampsia, miscarriage, your baby having a low birth weight, anemia, stillbirth, congestive heart failure, although this is very rare. These risks are only relevant if you have severe hypothyroidism, and if your thyroid disease is well controlled, then there will be low or no impact on your pregnancy. How could my pregnancy affect my hypothyroidism? Because of the need to take extra thyroxine, thyroid function tests may be out of range if not checked and treated. This can cause symptoms like tiredness, difficulty controlling your temperature, muscle cramps, constipation, problems with memory or concentration. You will have regular blood tests throughout your pregnancy to test your thyroid function, and your midwife will support you with adjustments to your medication if necessary. What should I do differently prior to pregnancy? As importantly as for all women trying to conceive, you should improve your general health. Things like stopping smoking, maintaining a healthy BMI, and taking folic acid. For women with hypothyroidism, you can also prepare for a healthy pregnancy by eating a healthy diet with foods that increase your iodine intake, like dairy, eggs, meat, fish, and poultry. You should aim for a daily intake of 250 micrograms, and you can also take iodine supplements up to 150 micrograms. You should avoid seaweed supplements and Lugol solution, as these have high iodine levels, which can cause problems with your baby's thyroid levels if you do become pregnant. You should ensure your thyroid function is optimal with blood tests before conception, and as soon as you receive a positive pregnancy test, you should discuss with your GP increasing your dose of thyroxine by 25 micrograms and arrange for a blood test to check your thyroid function. You should be aiming for a TSH of under 2.5 milliunits per litre. What should I expect during my pregnancy? The main objective is for your thyroid function to be in range as early as possible so that the increased demands of pregnancy can be met by increasing thyroxine. It is recommended that your thyroxine dose is increased immediately following a positive pregnancy test by 25 micrograms, and that you have a thyroid function test within 7 days. You'll be offered blood tests every 4 to 6 weeks, which can be done by your midwife, and you'll be contacted if you need to make adjustments to your medication. As your pregnancy progresses, it's very common to have to change your doses. After 16 weeks, you will then be checked about once every 3 months with a follow-up check after 4 weeks if your dose has been adjusted. If your thyroid function is normal, then no additional tests are needed and your pregnancy can be managed as normal. The vast majority of women with well-controlled hypothyroidism have uncomplicated vaginal births, and you will be able to choose between all the options available as to where you give birth, which could include in a birth centre or at home. After the birth of your baby, your thyroxine doses will be put back to how they were before you were pregnant, but you may be advised to increase this if you were out of range in early pregnancy. Your GP will do another thyroid function test after 8 to 12 weeks, and breastfeeding whilst taking thyroxine is safe. When should I seek help? You should contact your GP as soon as you have a positive pregnancy test to increase your thyroxine dose and arrange blood tests. If you're concerned about your tests, symptoms of hypothyroidism or their effect on your baby, you should contact your GP or your midwife. To recap, uncontrolled thyroid disease can make it harder to conceive. Thyroid hormones are crucial for your baby's brain development, and you will need to take additional thyroxine during pregnancy. You will need to take more regular thyroid function tests. The vast majority of women with well-controlled hypothyroidism have uncomplicated births. Breastfeeding whilst taking thyroxine is safe. If you are ever worried or have any questions or concerns, contact your midwife. Thank you for watching. This educational video was created by the West Maternal Medicine Network.